Assessment of mouth and oropharynx. Hey ma'am, I'm Lavrin Kagingin, student nurse from APCAS. I'm here to assess your mouth and oropharynx. What's your name and age?
In order to do the assessment, I need your information. So I just have to inspect how you make your mouth, and then so we can know the findings so magagamit nyo for your future check-up. Then international individuals, any concerns with the process po. So can we start na po?
Perform hand hygiene and provide for client's privacy.
I just have to ask you some important questions. It is coming from your mouth and oropharynx. So, meron po ba kayong ulcer? Any medications for your neck? Last dental check-up niyo po? Meron po ba kayong denture discomfort?
Inspect the outer lips for symmetry of with contour, color, and texture. Ask the client to purse the lips as if to whistle. The client should have uniform pink color, soft, moist, smooth texture, symmetry of color, and ability to purse lips. Deviations from normal is pallor or cyanosis, blisters, and inability to purse lips. The client has a uniform pink color, soft, moist, smooth texture, and symmetry of contour, and ability to purse lips. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and uniform color. After applying the clean glove, ask the client to relax the mouth for better visualization. Grasp the lips on the each side between the thumb and index finger. Pull the lip outward and away from the teeth. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Ask the client to open the mouth using tongue depressor, retract the cheek, view the surface buccal mucosa from the top of the bottom and back to the front. Repeat the procedure from the other side. Examine the teeth for proper visions of the molars. Use the index finger to both of hands and retract the cheeks. Observe the number of teeth, tooth color, and the state of fillings, dental careless, and tartar along the base of the teeth. Inspect the gums, observe the bleed, the color, and retraction. The client has complete teeth, smooth, white, shiny tooth enamel, and pink gums, moist, firm texture of gums, and no retraction of gums. Inspect the surface of the tongue for position, color, and texture. Ask the client to extend the tongue. Inspect for the tongue movement. Ask the client to roll the tongue upward and move it from the side to side. Normal findings are moves freely and no tenderness, and the deviations from normal is restricted mobility. Inspect the base of the tongue, the floor mouth, and the frenulum. Ask the client to place the tip of the tongue against the roof of the mouth. Inspect for the hard and soft palate for the color and shape, texture, and the presence of bone prominence. Inspect for the uvula for position and mobility. While examining the palates to observe the uvula, ask the client to say ah so the soft palate arise. Inspect for the oropharynx for color and texture. Inspect one side at a time to avoid eliciting the gulp response. To expose the one side of the oropharynx, press the tongue depressor against the tongue on the same side of the halfway back while the client tilts the head back and the open mouth wide. Use a pen net for irrigation and needed. Inspect for the tonsils behind the fauces for color, discharge, and size. Remove and discard the gloves and perform hand hygiene. Document the findings in client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.